Follows meetings in recent days of the National Coronavirus Command Council, the President's Coordinating Council and Cabinet. Ramaphosa also hosted a virtual engagement on Sunday, 10 January 2020, between government and interfaith leaders on the COVID-19 risk-adjusted strategy, which is an inclusive national effort that enables adaptive responses to the shifting pandemic. This engagement focused on the unfolding pandemic in the country and on the continent, including efforts to secure vaccines for all. That has been at the top of mind for many. Political analyst Prof Lesiba Teffo and Senior Research Associate at the Institute for Global Dialogue Sanusha Naidoo joins me now to project what the President might say. As we mentioned, the push and pull factors influencing this decision. Hard lockdown, good evening to both. Hard lockdown was said over and over again that it was to manage the situation. Professor Teffo, let me start with you. Would there be any plausible reasons why we would have to knuckle down harder in terms of movement restrictions and other restrictions, even possibly to the economy?
No, I'm struggling to follow you. You are breaking. I really don't follow properly, ma'am.
All right, let's see if we can reconnect with you, Professor Teffo. Sanusha Naidoo joining in the conversation as well. Ms. Naidoo, what are your thoughts around this? Is there anything that would justify that? Tightening the restrictions on movement, some businesses, etc. Some people are saying from our viewers, continue with the ban on alcohol. There's been fake news about ban on cigarettes as well. What are your thoughts?
Good evening to you and the listeners. I think in a way, what we are seeing with the numbers are not a kind of steady increment in terms of what we are seeing with the 24-hour rate of infections. It's very staggered. It's fluctuating in an unpredictable way. We are ranging anywhere between 11 and 23,000 within a 24-hour cycle. So I think in a way, what we probably will hopefully consider is how to deal with outdoor events, how to deal with management of indoor events, gatherings, etc. We know that this has been reduced indoors to 50 people, outdoors to 100. We're talking about places that are highly ventilated, but we're not sure whether people are actually adhering to these standards and these regulations. And I think that's going to be one of the key issues in terms of what perhaps even the South African Medical Association has come out with. Also in terms of transportation, again, people are moving between their workspace and their homes, etc. But again, monitoring that space, and of course, people going back from their holidays from the coast and so forth. I'm not sure whether a hard lockdown is something that's going to change social behavior, change people's mindsets about what they need to do as part of the responsibility in helping to at least address the way in which the transmission is taking place. We do know with the second variant that we are currently in that transmission is very, very volatile. It's unpredictable. And so it's becoming much more difficult to say that we just have to restrict ourselves to the basics around the sanitation, the wearing of the mask, etc. I think what we are beginning to realize is that the mutation of this virus is highly unpredictable. And so this means that social behavior has to change. I think that it's a minimalist condition that we need just to say wear the mask, sanitize, etc. I don't think the President can emphasize that enough. But it also requires us as citizens, from what I could glean based on some of the Twitter responses you read out, that ordinary South Africans also have to now start thinking about what their social responsibility is, not only to themselves, their family members, and their immediate circle of acquaintances and so forth, but to the broader public. And I think that is important.
Let's get to another point of view now. Professor Teffo, as mentioned earlier on, the hard lockdown was about the resource requirements on how to restrict the disease from spreading. We're seeing now that the health system is buckling under pressure again. So what would be the immediate move that the government can take to arrest that, ensuring that we've seen people die because of lack of hospital beds? Movement has been one of the reasons we've seen the disease spread because of super spreader events. So what would be the most urgent action that the government can take that is well within what people think is reasonable?
Yeah, I wish I could say I follow you in as much as Sanusha is doing, but my understanding is the government can only do so much and no further. As said, it is in our hands and it is within us. The observation, yesterday I watched a football game in a village, and I just wondered when I looked at the elders to say, really? So in the main, I think is the message and the messengers, and all of us, one or another, should play this role of trying to inculcate a sense of responsibility, that indeed, if we are to turn a corner, all of us must play a role. Government can come up with policies, with protocols, but we are where we are today precisely because we didn't act responsibly. I do tell even those who take alcohol that yes, the taps are closed precisely because you and I didn't act responsibly. And yes, the president will speak and he can tighten to the extent possible, but certainly not up to number 5.
Okay.
And even if we're to go to number 5, but it is still within us. And I think it is our duty, civic duty indeed, to ensure that we do the right thing from a villager. And incidentally, it is the elderly who tend to be more responsible than the middle class, the learned, the literate. Because what I have observed in the main where I come from is that is the middle class that could afford to organize parties at a fairly high and sophisticated level.
Okay.
The price to pay is very high.
Okay.
But there is a role to play.
We seem to have 40 minutes, so I'm hoping to get as much out of both of you as possible. So if we can be as brief with the answers as possible so we can cover as much ground. Ms. Naidoo, I'll come back to you. A lot have been concerned, obviously, about the prospects for economic recovery. But given what Professor Teffo has just said, those who are guilty of transgressions and also the health model that seems to be followed by scientists is pretty much based on susceptible, exposed, infectious, and those who have recovered. So if we're looking at businesses and employers, would you then restrict that in terms of the numbers of people who physically go into work? Are we likely to see that?
I think the challenge here is how do we redefine this economic model? I think the problem here is that we are trying to adapt or we're trying to fit the virus into the model. We're not willing to change how the model has created a non-trickle-down effect. Nobody's benefiting out of the way this model is defined, and I think that for me is the bigger existential crisis that we can take out of this pandemic, because the pandemic is telling us that the inequality, the model is based on an idea that if you move within a space, that everything will eventually evolve, where you'll eventually get to where you will be able to enjoy the benefits and the labor of your production and your productivity. Unfortunately, we can see this not being the case, because we can see people in the informal sector who have not been able to survive. We can see the tourism industry. So I think for me, the challenge is perhaps this is an opportunity for South Africa and for Treasury and all of the economic stakeholders and clusters in government, including business, to rethink this economic model, which we now realize hasn't really lifted people out of poverty in South Africa. We are relying on the state to provide some kind of grant or basic income grant to sustain livelihoods, because it's lives versus livelihoods, and it's movement. So I'm not sure what the process is going forward in terms of whether or not we ask ourselves is this model sustainable? Because at this point in time, it's showing us that we're trying to adapt the pandemic and our responses to the pandemic to what the science is saying. The science is saying that as you move, the infection rates start to increase. As you sit still, you see a bit of a flattening of the curve. But I also think it's the challenges that we have around the industry and what kind of industries that we need to promote that don't create this pandemic in terms of what becomes the vulnerability.
So we'll look at those industries in just a moment. We'll look at those industries in just a moment. And Professor Teffo, I'm hoping that you can hear us a little bit better. Just looking at that economic model, the bedrock of which has been the education sector, and the basic education department saying that it believes that all things should be on track for reopening of schools. What are your thoughts about this? Should we continue prioritizing education amidst the fear that this variant could, we know that it affects young people more, but that actually could be a super spreader in schools?
Yes. In education lies the future of any country. And I think it's St. Augustine who said, catch them young. If you internalize what is desired and desirable in the young ones, when they go back home, you know what it means when it comes from the teacher, that they will ensure that all the magogos do the right thing. The villagers do the right thing. Invest in them and ensure that that happens. But let me shift a little bit to go back to the role of business in this, and the role of the churches in this. I'm a bit sympathetic to the leadership in this instance, because the models we can talk about at a very scholarly and scientific level, and rightly so. But at this stage, I think a minimalist approach, the simplest approach, less complicated and less convoluted language is the one that needs to be used. And men and women of influence in the communities, including traditional leaders, indigenous knowledge holders, if they can come through the fore and help send this message, then we can instead stem the tide or flatten the curve.
All right, Ms.
But in education,
Right, Ms. Naidoo, you were saying earlier on that you'd like to suggest the businesses that perhaps government would like to focus on if were to at least reduce the restrictions in some places but increase in others. Which are those?
No, I think it's difficult to actually say that anyone singles out as a particular industry where you can become more kind of interventionist around movement and then less in the other. I hope I'm understanding you correctly. But I do think that what you can do is repurpose a lot of these industries that can actually focus around this kind of building up the manufacturing base from a domestic level up. I think the model that I'm referring to a lot here is this export-led growth model, which essentially means that you are depending on external markets to essentially harness and mobilize your growth model. I think we can be very creative at this point in time in how do you build up the domestic resources of the state and of the economic conditions in society. For example, if you're going to repurpose a SOE, repurpose that SOE towards reskilling the people within that SOE. Don't just throw money at a problem. I think that is a challenge in itself. It doesn't repurpose what the SOE can do. It can actually repurpose people's skills and upgrade skills in a much more dynamic way that can be used for creating what you call sustainable environments, sustainable cities in your big metros, building urban gardens, building sustainable agriculture, etc. Now we hear that the land bank may be given a bailout of some form. This can be done in a much more creative way where you can repurpose, reskill. Don't just give the land bank the money, because this is where I think we're still sitting in a kind of old belief system that if we throw money at something, it's going to magically redefine itself and repurpose itself. It's not going to happen that way. And I think this is what the creative interventions need to be thought about. And I completely agree with Prof around building up that indigenous knowledge base from the bottom up. I think we have a lot of biodiversity that could be used in our own practices around how do we deal with the pandemic and the kinds of interventions that would be appropriate in terms of medicine, indigenous knowledge systems, etc.
And perhaps just to pick up on that last point, Professor, we're speaking to a health expert earlier on who lamented the lack of, perhaps I'd say, sophisticated or more evolved communication strategies. So what will we use now to help people understand is, per your observations, that there are sectors in society who are not observing this, but also we want to make sure that we create future leaders out of this. So, I mean, this seems like a health crisis that will be with us for a long time, as observed by the WHO DG earlier on.
Okay, if it's meant for me, that's fine. Look, we tend to speak to ourselves, the learned, the literati. And if you talk about at least a different communication strategy, perhaps is what I was alluding to. Indigenous knowledge holders, traditional leaders, men and women of influence in the communities. Those are the people can help also to send the message in a way and in the language understood by the locals. That's one bit that I wanted to talk to. But I want to get back to the question of education. Look, had we gotten it right in the past 26 years, and I like the passion that Dr. Nzimande has for TVET colleges, but unfortunately, those colleges don't serve any purpose, and I'm part of that of the structures there, in the sense that there are no equipments, there are no properly qualified people to teach them. And with that, the students get out with certificates, but without the knowledge. We don't have artisans, but we have got people with papers that at least purport to represent something else. So if you talk repurposing of education, and indeed if you want to make a difference, it cannot be business. It must also be about the quality and the relevance of what is being provided. Would you be
relating that to the move the president would then have to make with regards to a movement between provinces, as in a higher education? Should that be delayed, or, just to bring the conversation back to what we're looking at, reflecting what the president will announce to us later on?
Look, at least put in one way or another, I wouldn't have a problem with the restriction of movements, because we are where we are precisely because when we are advised we don't do the right thing. We tend to cheat ourselves. Lying is something else if you want to talk logic. You know the truth, but you pretend not to know the truth. You are told what the right things to be done are, but you don't do them, and you want to cry foul and point the finger at the government. I cannot go along with that type of reasoning. If you were to say, let's restrict some movements for a week or two. And indeed, I would be even happier if the president will continue with the alcohol ban. As a Black African president, he knows with COVID or without COVID, come Christmas time, there is a lot of pain in the African community. There is a lot of stress on the hospitals. So my strong recommendation to date, and I know it's not a popular one, keep the alcohol ban for another 15 days. You will quickly stem the tide. And indeed, let's bear the brunt, the economic inconvenience, but I think it is worthwhile.
Ms. Naidoo, just to, I suppose this conversation does continue to circle around the economy, and you mentioned earlier on that perhaps we may see risk appetite, which will see a boost in local exports. But I want to look at the political outlook and how everybody has said that vaccination is something that will improve our lot. from an investor's perspective, do you think that they are looking for things like that? Which country is ahead or, far in the queue of vaccination? Would we suffer from that? The fact that there's been that criticism that we haven't moved fast enough, is that important? Will that impact our economic landscape?
I think there's two ways to look at that question. One is the idea that the vaccine is now considered to be a policy stabilizer, that this is what stability means. Right now, political risk in terms of what investors were looking at within particular societies and in the global economy, and particularly with South Africa being under the hammer of the credit rating agencies and being downgraded so many times, I think the idea was that it was all about policy uncertainty. Now, whether we use vaccine certainty as a basis for political risk will be very interesting, because then it means that you're basing that on the idea that if with countries that are far ahead with vaccinations and in vaccinating their population, and particularly which age group, that I think is very important. So they're vaccinating first, I think, frontline workers. They're vaccinating people that are the key drivers of the economic production sphere. I mean, between 18 and 45, or between 23 and 45, or even going up to 50. I mean, these are going to be critical dimensions for any economic kind of outlook. I think for South Africa, and I think for the world over, for the global economy, yes, there will be that kind of consideration in terms of how investors will consider societies as stable or consider countries as moving towards some level of stability. But I also think there's a second argument to that, and that is the flip side of this, and that is we don't know whether this vaccine is going to be immediately taking on and creating herd immunity. We're moving into second and possibly third, I don't know how many other strains of this mutation of the virus. And so what we're doing now is that in South Africa and in other parts of the world, there is vaccine hesitancy, where people are unsure whether this vaccine will create other disruptions to their DNA makeup, to the way the constitution of their body is. And so there's a bit of a hesitancy and there's a pullback. And so this has implications for every country. And I'll be very disappointed to see investors using that as a criteria.
And Professor Teffo, the president, I believe, is about to speak in about 2 minutes or so. And just before we continue with this conversation, let me welcome our SABC 2 viewers. So let's talk about local investment. Obviously, situationally, it's different from provincial to district level. So job opportunities are something that's heavy on a lot of people's minds. How do we create employment imaginatively at that level? What are we saying to local investors in line with the restrictions that people have to face, whether it's movement or lack of resources because of the effect of COVID-19?
Yeah, the balance there is the one that is a real challenge. But at the same time, we are faced with an existential threat, and we might say, what comes first? And I think people would say life comes first. Had we not acted irresponsibly, we wouldn't be where we are. And I say we can bear another 15 days of what we are going through right now without any amendment, and we can turn the corner. The people in the village, the economy will suffer one way or another, but we can still redeem ourselves at a later stage. And lastly, the question of grants for me, and how to mitigate the concerns and the unemployment. And so I do feel like able-bodied young men and women, one way or another, they could have been used better to access and to get that 350 rand in their villages and in their communities. This dependency syndrome that is being fed indirectly by the state is also responsible for the lethargy and sloth that is almost an endemic and characteristic of certain individuals. Find a way for the people to earn whatever intervention you want to make.
Ms. Naidoo, as we wait for the president to speak, which will probably be any moment now, so if I do interrupt either of you, please accept that so that we move on straight to that. But what you were speaking about earlier on about investors' view of our vaccination program and preparation for it, the WHO mentioned that earlier on, that even the wealthier countries are themselves struggling with the implementation. So from the pessimism that already exists in the country, how can we understand the challenges that face South Africa, not of its own making, in what it has to face in the rollout of that program? It has mentioned that it will pull out all the stops, including bringing on board, people who are studying to be nurses, who are in their last year, etc., to make use of, at best, with the resources that it has. But just share with us how people should be looking at this, what's going to happen over the next couple of months.
I think, firstly, people believe that vaccination, the 1.5 million vaccines that have been procured from India, etc., I think is going to be critical for rolling out that implementation program. I think also what we've got to be careful of is placing all our bets on the vaccine. I think we've got to start thinking about how we also have to start utilizing, when we wait for that vaccine rollout. I don't know how many million people are going to get it and by when, but just to start thinking about our own constitution, our own ways of dealing with how we actually mitigate risk. The third thing I would think is important here is that it's important to start getting people into the space early on. And we can't emphasize enough that the healthcare system is in a precarious situation. It needs investment, it needs infrastructure, it needs upgrading. And that can only be done if there's in the kind of investment that comes in. I don't know where the money comes from, whether you tap into pension funds, whether you tap into the surpluses. I've heard earlier this afternoon about a basic income grant, which can be then brought in from different revenue streams that the Treasury has. I don't know where this goes, but I think what people are going to be very careful of is very worried about what's going to happen to their revenue streams, what's going to happen to their pension funds, if indeed money starts moving in that direction. Last thing I want to say is, I think what's important here as well is that this economic debate we're having, because we're saying it's the pandemic, it's always been there. It's been an underlying current in our society for a long time. People in rural areas, their livelihoods have been dislocated. Their livelihoods, they haven't been earning an income. They've been relying on grants. And I think this in itself is an important reflector, if not an important issue for us to think about, that it took a pandemic for us to suddenly say, oh, the economy is in a crisis. The economy was always in a crisis in South Africa.
And Professor Teffo, obviously we did speak about the push-pull effects that the president, whatever he announces, he can't please everybody. One of the things that has been obviously a major bone of contention has been the lack of predictability of our energy supply. Eskom and the brownouts or blackouts, whatever you wish to call it, just looking at what we can do going forward to help recover. Okay, we understand the president is speaking now. Let's go straight there.
Limadekwana kabathu bote molweni nonke